Hello there, my name's Dr David Smith. I'm a cardiologist in Swansea, and Heart Valve Voice have asked me to talk to you about a few things that have certainly cropped up in light of the current coronavirus pandemic for people with heart valve disease. And the first thing to discuss is probably about clinics and being reviewed in hospital. It's important to point out that we are still running clinics in hospital, but we're trying to prioritise those who we feel are in most need of our most soon attention and perhaps urgent intervention, compared to those people who we feel may be able to wait with more stable symptoms over a slightly longer period of time. And the second point really brings me on to symptoms themselves. I think it's very important that despite there being a coronavirus epidemic, we shouldn't minimise symptoms that we know are caused by heart valve disease. And certainly what we want to know as clinicians is if you're having worsening symptoms or either an onset of new symptoms, and particularly increasing breathlessness or perhaps dizziness or the feeling that you might actually pass out. Those are symptoms we need to know about, because those help us prioritise more urgent treatment. People are also sort of worried about coming to hospital for clinical review, and they're particularly worried obviously about contracting coronavirus in the current outbreak. But I think it's very important to point out that we've now had a good month's worth of experience throughout the coronavirus pandemic of taking full precautions as doctors and nurses to minimise the risk of transmission of the virus. So I wouldn't be worried about coming into hospital. We're taking full precautions, and we are also running and treating people with our clinical programs. It's just they're being slightly slimmed down because of the coronavirus epidemic. People have also been inquiring as to whether COVID, the coronavirus virus, can infect people who've had a new or previously operated heart valve implanted, and categorically the answer is no. Coronavirus does not infect previously implanted heart valves. And that brings me on lastly to people who've got stable symptoms and what we're going to do in terms of treating them. Whilst I've said earlier that we should prioritise people with escalating or new symptoms, those people who've got stable symptoms, once the coronavirus pandemic hopefully relents, we will be planning to hopefully get through the backlog of people who are clearly currently waiting for heart valve treatments. And together with Heart Valve Voice, we as clinicians will be taking steps to make sure that we can prioritise treatment when we're able to do so. So that's all from me, and I hope that you stay well during the current coronavirus pandemic. And if you do have any concerns, please do get in touch with your clinical teams. Thank you.